nerves. Coming out. See them all up there? We can't see the nerves, but it tells you every pair of spinal nerves is responsible, sensory and motor-wise, for a particular area of the body. So like the two coming out right near T5, right there, T5, that's the area of the body that those two spinal nerves are responsible for all the motor and sensory activity. So that's its dermatome. So each pair of spinal nerves has its dermatome, the part of the body that it's responsible for as far as any motor or sensory activities. Okay? And that's all you need to know about dermatomes, because now we're going to look at plexi. Cervical plexus, brachial plexus. See what's happening here. So cervical plexus, brachial, lumbar, sacral. So it involves spinal nerves. Okay? So what I'm going to do is go through each one of these. And the first one is mainly to show you what's happening in a plexus. And then what nerves are you going to be learning? And all these, of course, are in your on the checklist. Okay, this is the cervical plexus. So every one of these plexi, you start with a set of spinal nerves. Here we have C1, 2, 3, 4, 5. 5 spinal nerves. Now I just said that each pair has its own dermatome. Okay, so each pair would have its own area of the body it's responsible for. But now what happens is that they begin to interconnect. Those 5 interconnect and connect with each other and form a network. It looks like this. You can't tell where those are anymore. So like axons that was up here now can go into this. I mean, it can go anywhere. So it kind of breaks down as far as a separate dermatome for each. Okay, because there's such a big network intermingling of all of these together. And what happens is you've got this nerve coming out here, a nerve coming out here, a nerve coming out here, all these nerves coming out. Like here's the lesser occipital nerve, transverse cervical, a bunch of them, okay? So that's what's happening in the plexus. There's only one nerve you have to know out of this plexus, okay? It's the phrenic. The phrenic nerve right there that goes to the diaphragm. So that's the only one. Spaghetti Man has a good phrenic nerve. Okay? So that's all you need to know on the cervical plexus. Okay, let's go to the brachial plexus, which you're going to be a little more involved with. So what's happening here? Okay, first of all, you start 1, 2, 3. Again, it's 5 spinal nerves. C 5, 6, 7, 8, and T1. Okay, there they come. And all of a sudden, they form 3 trunks. So 5 goes down to 3. They throw off a few nerves in the process. And then those 3 trunks divide out into divisions. They don't even label those. There's several divisions. The divisions then reform 3 cords. Okay, those are right here. Now, the process of doing all that, you've got suprascapular nerve, all these, you can see a lot of nerves there, okay? So, we're going to pick it up on the cords. You don't have to know anything before the 3 cords. So, that's good.
No. Okay.
going to draw 3 chords here. And this would be the lateral chord. This is the medial. Posterior. Okay, so here's the lateral chord, here's the medial chord, here's the posterior chord. Now, you all have been through Unit 1. Those terms mean something, right? They're directional terms. So you're probably asking me, medial to what? Lateral to what? Posterior to what? If you knew what the what was, you'd be able to find the 3 chords, right? Because you know it's right there. And that was on the exam. The what was on the exam, and you all got it right. The axillary artery. The axillary artery. You remember when you were looking up here and you saw the axillary artery in the thing, and all those nerves kind of gathered around it? Okay, those were the 3 chords, which the axillary artery stands right here. So obviously, that's lateral to it, that's medial to it, and you can't see it here because it's behind it, or posterior. So if you find the axillary artery, you have no problem finding the 3 chords. But you won't anyway, because the 3 chords will have tions on them. So all you gotta do is pick up one of those tions. So it'll be really easy for the 3 chords. Now, from these 3 chords, you learn 5 major nerves. The lateral cord has 2. Okay. The medial cord has 2. But you notice that the 2 inside branches form the same nerve. This is the median nerve. This is going to be the musculocutaneous. I'm going to write that all out. And this will be the ulnar. So the lateral and medial chords, 2 chords form 3 nerves. And you can see here, you see the M? Okay. Look for the M, and that will show you the 3 nerves coming off the 2 chords. Okay? Obviously, the musculocutaneous stays in the arm. Doesn't go anywhere down farther. The median goes all the way down forearm. The ulnar, you've already seen it. It's right next to the ulnar artery. So you were looking there, you only had to learn one thing, now you can learn the other one. Back here, we have the axillary. So that stays in the armpit. Kind of just disappears in there. And then you've got this one coming down, which is the radial. So where is it going to be? Right next to the radial artery. And you've already seen it. Okay? But you're going to learn it both here and here, not just in the forearm, but up in the arm. So those are the 5 nerves coming from the 3 chords of the brachial plexus. So that's all you need to know. Okay. Now, for the next 2, the lumbar plexus and the sacral plexus. Just a couple of things, and you're not going to learn very many nerves, but the same thing's happening. We're not going to go over it again, but you start with a bunch of spinal nerves, and then they all interconnect. So you have a plexus. The lumbar plexus is an anterior plexus. All the nerves are in the anterior part of the body. Okay, so you have to see it from an anterior view. The only two nerves you're going to be looking at are the femoral nerve and the obturator. And you've already seen the femoral over and over and over. Every time you look at the femoral artery and the femoral vein, there's right next to it was something that was white. Femoral nerve. Okay, so that's the only two you're going to learn on that plexus. The sacral plexus is a posterior plexus. You have to look at it on the posterior part of the body. And the major one is sciatic nerve. So remember the male, when he was on his stomach, you could see under the gluteal muscles the sciatic nerve. So you've already seen that. Now he's turned over on his back, so you won't see his again, but we took it out on the female, so you're going to see it on the female this time. And then it has two branches. In the popliteal region, it branches into the tibial and the fibula. So basically, that's the plexi. So there's not all that many nerves. So you don't have nearly as many nerves to learn as you did vessels. Okay, that basically finishes up the spinal cord and spinal nerves. So now we're ready to go through the organization of the brain, that section. Okay, this is not from your book. I'm just going to use it to kind of point out one thing, and then we'll start with the individual parts. Okay, your brain includes the cerebrum, which is the biggest part. Actually, that's just half of it. We're looking at a side view. A midbrain, which is in here. A brain stem, right here, has 3 parts. Okay, and you have your cerebellum. So these are the major parts. We're going to take them one at a time. But if you look at this, the spinal cord and all of these are in series. Can't get to one without going through the other. So if you've got a message coming from the spinal cord and it wants to go to the cerebrum, it's got to go through the brainstem and the midbrain to get there. So there's a ton of pathways to let that occur. So they're in series. You know, like electricity, you have series, so forth. But then notice that all these are in series, and sitting out here all by itself is the cerebellum, in parallel with all of these. In parallel with it. So just kind of visualize that, and Monday, we'll find out the significance of the fact that it's in parallel to these. There's a very important reason for that. Okay, so before we go to the brain, we've got 3 things we got to pick up on. First of all, let's just go over the ventricles and the hollow portions. Remember, all these ventricles contain cerebrospinal fluid. And so you have the lateral ventricles. There's 1 and 2. I don't know which one is 1 or 2, it doesn't matter. But those are 2 ventricles. And then you've got the mid one right here, the third one, which is midline. You've got the 4th ventricle. Of course, the central canal is part of this. So all of these spaces of ventricles are filled with cerebrospinal fluid. Pretty soon, you'll find out about the flow. Now, anytime you've got a cavity in the body that has a fluid, it's just not sitting there doing nothing. It's moving. Everything flows. Cerebrospinal fluid flows. So we'll talk about that shortly. Okay, so that takes care of the hollow portions, the ventricles. Okay, now let's touch upon the meninges. So there are some distinct differences between the spinal cord meninges and the cerebrum. Okay. You're going to have the duramater, arachnoid, and pia mater. Okay, so let's look at this. First, note here that the bone has been removed to get this view, so there's no bone up there. All right, so now, first thing, there is no epidural space. There is no epidural space, which means the duramater is actually attached to the inside of the skull, to the bone. Okay? So the bone that we removed here is attached. So this causes a problem. You know, when we take the skull cap, you know, on the female we had to scalp her, so we had to take the scalp and pull it back, expose the bone. Then we cut it around and remove the skull cap. Now the process of removing the skull cap, you have to separate the duramater from the bone. Usually it sounds something like this. That's what it sounds like. Good?
Funny.
But that wasn't the case this time. The duramater did not separate. Sometimes it's stuck so hard you can't pull it apart. So what happens, it comes off with the skull cap. You don't see it on the brain, you see it on the skull cap. Last semester, the duramater was on the cerebrum. But this time it's on the skull cap. It's just sometimes we're lucky, sometimes we're not. And it's not that it's abnormal, it's just sometimes it sticks more than other times. So, that's where you're going to see the duramater. Another thing about the duramater, as you all know, it has veins embedded in it. Remember the sinuses? The superior sagittal sinus, you have the metaphyseal, straight sinus, all those sinuses. That's venous blood, so they're veins. They're embedded in the duramater. So that makes that quite a bit different than the one in the